Good afternoon, everyone. It is officially 12:30 Eastern Time. I would like to welcome you to today's Fireside Chat. My name is Heather Flattery. I will be your host today. I'm the Manager of Membership and Marketing here at the Society for Public Health Education. Just a couple of logistic things to get out of the way before we dive in. If you are just now joining us for the Fireside Chats, you may join by computer or by phone. All participants will be muted, but there will be an opportunity for question and answer at the very end. If you wish to pose any questions to myself or Cicily in regards to membership, SOPHE Advocacy, etc., feel free to use the participant feedback chat box in the lower left corner of your web browser. You can just type in questions there and we will flag them for part of the Q&A portion at the end. This is about a 25-30 minute conversation, so again, thank you for taking some time out of your day to join us. Feel free to pop in and out as needed. We started the Fireside Chats a few months ago, and we have been interviewing particular leaders, thinkers, and doers within the SOPHE community. So I hope that you enjoyed today's talk. Today we are going to be interviewing and having a discussion with Dr. Cicily Hampton, our Chief Policy and Programs Officer here at the Society for Public Health Education. If you would like to know how to follow her, stay in touch, get connected, we have provided a couple of different access points there for you. On LinkedIn she is available, and also you can follow or retweet her on Twitter. So before we, actually let's just go ahead and dive right in. So I want to go ahead and talk a little bit, Cicily, with kind of what brought you to SOPHE and maybe some of the background experience. I know that you're not immediately from the public health space, but maybe if you could talk about your background in advocacy and maybe some of the work that you've done previously and also currently.
Sure. So I often enter meetings with public health folks and have to explain the caveat that I am not a public health person. I don't have a background academically in public health, so I've never studied public health per se, but I am a trained lobbyist, if you will, and my academic background, my PhD, is in public policy with a concentration in health policy. So I've spent my career working in lobbying firms and for advocacy organizations on health care, on the healthcare side. So really my focus has been on Medicare and Medicaid, on delivery system and payment reform. I was working at an advocacy organization through the passage of the Affordable Care Act. So I have my fingerprints on that bill, and looking at ways in which to change the American healthcare system and the way that we pay for it. After that, I was able to work on evaluating a state Medicaid program that functioned as a patient-centered medical home. So it was one of the first in the nation and a benchmark and model for other patient-centered medical home Medicaid programs. And so I was able to move down to North Carolina to evaluate that program and see how this new model of care was working in terms of patient satisfaction, and then to do my own research in that space as well. Looking at things like provider and gender and language concordance, as well as things like housing and transportation access and social determinants of health within those programs. So from there, I came to SOPHE with the idea that we really needed a focus on prevention and health promotion in this country, sort of as a next step. As we're designing all of these, delivery system and payment systems to treat people who are already sick, it occurred that we could do the most good by preventing a lot of these diseases, particularly chronic conditions. We've not really had a great handle on that in this country, and so that's what led me to SOPHE and to become more on the public health side of things and health promotion. aspects. But it's really the same skill set that I have. I still use my advocacy skills. I'm still going to the Hill and writing and teaching and learning about how to do policy systems and environmental change, just in a little bit of a different space than the traditional healthcare.
Awesome. Well, thank you for sharing and giving sort of an overview of the background lens of where you're coming from. With that said, I really want to talk a little bit, because you are the primary professional here at the SOPHE office that works very closely with the annual Advocacy Summit. Now, I know that we have early bird registration that ends August 1st. And when we talk about the summit, I know that we often mention that it's 2.5 days of a conference where there is direct skill building, and then we can apply those skills actually going on the Hill should folks' schedules allow for that. But can you talk about maybe in the field of or profession of health education, or even in healthcare in general, maybe you're a layperson working in the field or doing something else with health promotion or health education, why is political engagement important? Why is that relevant to the work that we may be doing on a day-to-day basis?
So I would say more so than in previous subject matters that I've worked in, political engagement is critically important to public health, because a lot of the prevention work is heavily reliant on funding, in the way that when you're working in the healthcare system, you're working with private payers and organizations and companies that have a lot more flexibility. But when you're working in, sort of large-scale public health, a lot of basically anything that you hope to do, if you want to do a chronic disease prevention program, if you want to tackle obesity, if you want to do, tobacco prevention, all of that is coming through, your CDCs, your NIH, all of these, the different HHS agencies, and all of that requires money. Before you get to talk about the ideas, you have to get the money first. And so that's why I would say political engagement is particularly important to the profession of health education, because, for that reason, where you sort of have these abstract ideas and you're really working to address upstream causes, and that requires a lot more money than doing, let's say a pilot program in a doctor's office. But also you're in a really crowded field, and so health educators in particularly have to get out there, because you may be interacting with people who have never come across a health educator and who are not familiar with the field. And so in a crowded field of professionals, your doctors, your nurses, your neurologists, your physician's assistants, that people may have had more interaction with and are maybe thinking of when that's what they think of in terms of traditional health care, the employment. It's really important that health educators get their name out there too, and talk about how health education and health promotion is critical to the health of the country and to achieving a lot of the goals, like our Healthy People 2020 and soon to be Healthy People 2030 goals. Those are, firmly in line with health education. And a lot of people are just not in recognition of health education as a profession yet, even some people that are directly benefiting from it.
Gotcha. And so I think on that note, when you were mentioning who may be meeting with these different professional liaisons, it could be people working in the healthcare field directly, it could be legislators or officials. We're all coming from very different lenses. There may be, particularly with the summit, there may be students, there may be professionals who are certified health education specialists or Master CHES certified health education specialists, maybe individuals who are neither, but want to participate in being an advocate. Where do you start? Where does someone begin in advocacy? Can you give a quick maybe couple of points or some different things that someone can do to be an advocate?
I would say the first thing that you need to be an advocate is to find something that you're passionate about. This is something that you're going to be fighting for in many cases, particularly in this age of, appropriations right now and austerity and, sequestration and budget caps. So this is something that you're more than likely going to have to go to the mat for. So you need to find that issue that you have a personal connection with, or that you can really be passionate about, because it's going to require that sort of passion to keep you going. You're going to have to thoroughly research the topic. You're going to have to think of ways that you can address the topic, and it's not a one and done type thing. You're not going and you're not writing a paper or writing a report and then taking that to the Hill and someone says, "Oh, okay, sure, done, let's vote on it tomorrow." In many cases, advocacy is a long game. So you're working through different administrations, different makeup of the Congress, who's in control, different priorities, national priorities, and things like that. And so a lot of times you're looking at 10, 20, even 30-year goals sometimes. And, there will be incremental goals. Hopefully you'll have incremental wins in between. But, this, you have to find something that you're passionate about, because this is something that you could realistically be devoting your life to for the next, 10 years. So I always say that's sort of the first step, and that passion will keep you going. You'll learn academically, sort of like, the political process, learning appropriations and committee hearings and things like that. Those are things that you can learn as you go, but that passion is what is going to fuel you, and so that's always the place where you have to start with advocacy.
Got it. Okay. So let's say someone's just tuning in right now to the Fireside Chat. What are 3 things that they should take away from today's conversation?
So I would definitely say the first thing is find that thing that you're passionate about. The second thing is actually get up and do something, be able to get up and do the work. And the third thing that I would say is just to keep going. So, sort of to elaborate on that and dig a little bit deeper, there are so many things that you find that, it could be anything. It could be like a public health issue that you are facing or someone in your family is facing. But it could be something as simple as, garbage pickup in your neighborhood, or not having a stop sign where there should be a stop sign, or people speeding in an area where children are playing. And there's so many people that they notice something that is wrong, and that's the end of it. They maybe go home and they complain, or they, write a post on Facebook, and that's well and good. But in order to make that change, you actually have to do something with it. And so take that passion, take that wrong that's being done, and fuel it and funnel it into change, and use, the political process to do that. So whether that be, at the state or local level, or depending on the situation at the national level. And then, like I said, it's not one and done. You're not going to go to your city council meeting or to your legislator's office and say, this is the problem, and they're going to say, okay, sure, I'll fix it for you. So you need to know that first meeting is a first meeting, and you might have to have 100 more before someone agrees to even write a bill for you to address that issue. And so you have to be able to sustain the level of passion that is going to get you to your goals.
Got it. Okay. So I want to talk also a little bit, I know when we do these conversations, it's important for us to get our bearings around sort of who you are and what you do professionally, but I also like to get to know the presenters or the folks that come and join us a little bit personally. So can you tell us a little bit about maybe somebody who is a role model for you, or somebody that inspires you?
I've had a number of role models, I think, throughout my career, but I would say one of the people that I'm, really inspired by now is Michelle Obama, because I think that she has been able to use her influence in surprising ways, even through adversity. When she was attacked, even when there weren't necessarily fair assessments of her,
Right.
she's always been able to rise above, and she is even now, she is not a political person per se. She doesn't hold public office, and she has said that she's not interested in that, but she still is able to use her platform to do good. And I think that's really important. And so she's inspiring to me in a lot of ways, just her story of where she's come from and what she's been able to do and what she's doing now, even though, she could very much, retire and go off into the sunset. So I think that's who is inspiring me most today.
Okay. I would agree with that. I think she's a phenomenal leader, and I agree with you completely that I think she uses her platform in a very surprising way sometimes, just simply by who she's interacting with or the way she's doing things. It's unique, and I think that that's important for people when they want to speak on particular issues, or any issue really for that matter, to use their authentic selves in a way that makes sense versus trying to fit into something else. So another question I wanted to ask, and I hope this is of interest to our audience as well, being that you're a Chief Policy and Programs Officer, what are some of the skill set that you think helps develop or has helped you develop into this role and that you use regularly in order to do your job? Like, what are some of the things that you think you need or would be a requirement of this title if someone else wanted to try and grow into this position? What would that look like?
Sure. I would say there are three that are critical that I can think of. And so the first is time management. So anytime you have such a large portfolio, even though I have a team that sort of helps with particular policy areas and programmatic areas, I oversee SOPHE's entire policy portfolio. And that policy portfolio is very broad. It's the entire world of, health equity, health promotion, health education. Our mission is, in a nutshell, to make the world a healthier place. And so that is huge, and that looks like tobacco policy on a daily basis, but also housing policy on a daily basis, appropriations for CDC, appropriations for NIH, in addition to, getting into the weeds of all of those different programs. And so knowing where and being able to devote your time most effectively, particularly in an environment where you can get pulled off of something because Congress is doing something because they've not necessarily been operating in regular order for the past few years. So that time management piece has been critical, as well as prioritization, which comes with that. And I would also say leadership on these issues. There are a number of, while our policy portfolio is broad, we don't necessarily lead on all of those issues. We work a lot in coalitions, but the issues that we are leading on, you have to have the ability to lead on those issues. So you have to be well-researched. You have to have that leadership presence. You have to have familiarity with strategies to get the coalition or the group or the bill where you need it to be. And so also leadership. And then I would say the last skill is absolutely writing. So, when you are working on, doing any sort of policy analysis or getting information out, if you have new ideas of how we should be approaching a public health problem, you have to be able to write. And so publishing those policy briefs, one-pagers, fact sheets, all of that, every once in a while we're doing academic articles to get that evidence base in the literature that we can then use in our advocacy campaign. So writing is a critical skill for anyone who is interested in policy work.
That's a good point, and I think you mentioned before, and in a conversation that we've had, that there's actually a lot of writing that your job requires of you. But I think that can also be kind of a broad stroke. Is there anything even more nuanced than that? I mean, is there specific advocacy writing? Is there writing, like you mentioned, for the academic papers? Is there like if someone were to take a course in college, what is that? Is that qualified as a specific skill? How can someone kind of work on that if they wanted to become more proficient?
So the thing with advocacy that is different from many other fields is that you have to sort of be there. You have to be in it, and you have to do it to really be able to understand. So you're communicating extremely, extremely complex ideas. Particularly if you're coming up with a new policy and you're wanting to get people on board with that, and then committing resources to that. So if you're telling them I need $50 million and I can save 100 lives, you have to make a straight line argument to how that money is going to save those lives, and you have to be concise, you have to be compelling, and you have to be accurate. Because everybody is out and everybody's saying things, but you have to be the one, and that also goes to the leadership. You have to be able to be trusted. You have to be known for being, accurate in your statement. Because if someone takes something that's in your fact sheet and they go out and use it in their talking points on the floor and get lambasted because it's not true, you will never get to come back into that office, and your resources and your organization will be tarnished, and you will have that reputation. And so you really want to be extremely diligent, but also a very clear communicator. You don't want to write something that can be misinterpreted, that can be misconstrued, so that it leads to you looking bad. So it's really just practice, writing it and rewriting it, and doing it over and over and over again. And then, of course, there's, the messaging piece too. So you're not only, writing things that are clear because they're factual, you're also trying to find messages that are truthful but that also resonate with different audiences. And that, again, is something
so more
that
of like a narrative?
Yes, you're crafting narrative, definitely.
Okay.
But knowing which narrative resonates with which audiences on which topics is something that comes over time and with experience. It's not something that can be taught in a classroom.
Gotcha. Okay.
At least from what I've seen.
Well, that makes sense. Yeah, that makes sense. I think that's hard sometimes when people are starting out or when they're maybe a lower level professional and they want to grow in that area. I think sometimes maybe it's the part of the millennial in me. You kind of want it now. You want the skills now. You want the access now. You want to be able to execute now. So sometimes that's hard to be able to know that part of the learning is actually time intensive. It involves that. Well, I appreciate you taking the time. Go ahead.
I tell everyone that wants to get into this field, take internships and then take the first job in the field and just work really hard, and you will get there.
Okay.
But there are not really any shortcuts in advocacy, unfortunately.
Got it. Well, that's a perfect takeaway. I think that's excellent. With our last few minutes, we've got about 6 minutes left. I'm going to open it up for some questions. If anybody is interested in posing a question to Cicily or myself, you want to learn a little bit more about the summit, you want to learn a little bit more about her job role or her experience, anything about SOPHE more generally, the Society for Public Health Education, if you're new to us, please feel free to type anything in the chat box and let us know. We'll answer to the best of our ability or find the answers for you and get back to you. But we're here for that opportunity. And while we're waiting for maybe a question or two to roll in, I do also want to once again plug the 21st Annual Advocacy Summit. It will be October 19th through the 21st here in Washington, D.C. at the Washington Court Hotel. It's a 2.5-day conference where you have skill building over the Saturday, Sunday, and then we do a Hill Day on the morning of the 21st. So if you're interested in joining us, there are early bird registration rates currently that will end on the 1st of August, and then they will be going up. So if you are a student and you want to get in at the early bird rate or the membership rate, be sure to do that now. If you have a college or university that you might want to sponsor you, make sure to reach out to them. If you're a professional and want to learn more or possibly bring colleagues or students with you, please consider this opportunity. So I thank you all for joining us this afternoon. I haven't seen any questions roll in. So I'm going to go ahead and put back up the slide that references how you can get in touch with Cicily. If there's something that comes up later, if you have a follow-up question or you want to reach out to her directly, you can do that. I appreciate you making the time to join us today, and keep us on your calendar. Tune in for the next Fireside Chat, the last Friday of the month at 12:30 p.m. Thank you all, and we're going to go ahead and end this